Hi, I'm Bill Kristol. Welcome to Conversations. I'm very pleased to be joined today by Dr. Ashish Jha, the Dean of the Brown University School of Public Health, a longtime professor of global health at Harvard, very distinguished leader, thinker, and leader in practice, I would say, in the field of public health. I found Ashish's reading him very helpful, honestly. As someone who knows nothing, basically, about science and public health, I've I don't know how good a judge I am, therefore, but I think for someone who doesn't know as much, you've been both very clear, very alarmed without being alarmist, and I think been able to explain both the short-term and the longer-term sort of questions that have arisen. So I'm really looking forward to this conversation, and thank you for joining me.
Bill, thank you for having me on. I'm excited to talk about this with you.
So it's just to get clear for people who are watching this weeks and months from now, because I'm sure there'll be stuff to learn beyond the immediate. This is December, 22nd? And so where do we let's briefly go through where we stand and then talk a little bit about the different scenarios and prospects for the next 6-9 months, and then maybe lessons learned from this whole episode. So where are we? I mean, what do the next weeks and months look like? How bad is the community spread? How overburdened are our hospitals? Kind of the questions you get all the time, but are important, right?
Yeah. So here we are, December 22nd, finishing up the month of December. And it is reasonable to argue that we are in the toughest phase of the pandemic in the United States. More than 200,000 infections a day being identified. Best estimates are there probably more like 600,000 to 800,000 infections a day actually happening, but we're missing 2/3 to 3/4 of them, and 2,500, 3,000 Americans dying every day, and just an astronomical toll on our country. And the outlook for the next 4 to 6 weeks is not really all that great. I think we're going to continue to see high levels of infection, high levels of hospitalizations, high levels of death. We are at about 320,000 deaths right now. We will easily surpass 400,000 before the end of January. We might even surpass it by Inauguration Day. And the question is, will we keep going, or is it going to turn around? Is it going to plateau? Is it going to stop growing? And once we get beyond 4 to 6 weeks, Bill, I start getting pretty optimistic that things will start getting better. My view is that we are underestimating how bad the next 6 weeks are going to be, but I think we're also underestimating how much better things will get after the next 6 weeks. And I'm obviously happy to get into.
And that's not mostly due to vaccines, which won't have really kicked in a huge way yet, right?
Well, I think even actually partly it is vaccines.
Partly it is the vaccine already, that soon. Okay,
I think you'll start seeing the benefits because and we can talk about herd immunity and this idea of a threshold, but it really is a continuum. And I look at places like the Dakotas, for instance. The Dakotas have peaked in cases and have come down quite a bit in the last couple of weeks. And part of it is policy response, part of it is individual behavior. But I think part of it is just population immunity. My guess is that between 35 and 40% of the people living in the Dakotas have been infected already. That is an astronomically high number, a lot of deaths, but they're starting to get the benefits of all those infections, which is that there is enough population immunity. Not that they're not at herd immunity, but that they really are slowing down because of that. And I think we can get to 35% in the United States by mid-February between infections and vaccines. And that combination, I think, will help us really start slowing down. So I think vaccines are going to be a part of the solution.
Well, that's somewhat encouraging, at least, though the price we paid is pretty terrible, right? And just to stipulate on that without going back, and I did a conversation with Mark Lipschitz on this, and which people might look at from a few months ago, which I think has stood up very well. We went into more detail in the past there. It didn't have to be this way, right? I mean, it's really a failure of public policy.
It is, and what's interesting is the challenge here is to understand. Again, this has been, I think, a catastrophic failure on part of the U.S. federal government. And it is not, it's during this entire 9-10 months, I've been very public, very vocal, and consistently people want to draw this into a partisan conversation, that one political party is better or worse than the other at this. And I actually reject that. I've rejected it from early on, and I continue to reject it today. I firmly believe that, and again, this is about as much political as I want to get, but I just want to kind of lay it out. I firmly believe that if it had been a President Bush, a President McCain, a President Romney, um, any of the Republican nominees that we have seen over the last 20 years, this would have been a totally different federal response. We just happened to be caught up with somebody who could not wrap his brain around the fact that there was a real crisis and that the federal government needed to be marshaled for that crisis. And that has been probably the single biggest reason why we find ourselves with more than 300,000 people having died. Did not need to be this way. Even Germany, which has not done a fabulous job, but has done a good job, their death rates are about 80% lower than ours. So very doable, very doable. We could have done much, much better than we have.
Okay, well, that's unfortunate, but okay, let's
where
move
we
forward.
are.
So I want to talk about the vaccines, which everyone wants to talk about, which are very interesting, and both so many aspects of it. But just before we get to that, hospitals, you think will make it through the next 2 months? We're not going to have some catastrophic collapse of the
I don't think we're going to have
the country.
Yeah, I don't think we're going to have catastrophic collapse. What is happening, if you look at the hospital data carefully, is that hospitals are adding more capacity, but they're hitting constraints because they're running out of staff. And hospitals are reducing non-COVID care pretty substantially. So we've seen 20-30% reduction in ICU care for non-COVID patients. Now that sort of raises some interesting questions, like what's happening to those patients? But hospitals are adjusting. There will not be a catastrophic collapse. But there's going to be a lot of people who are going to necessarily suffer or even die because our capacities are going to get really strained. But I think we're going to get through the next 6 weeks without anything much more catastrophic than what we're already seeing.
How encouraged are you about the progress in therapeutics? I mean, given that still, even with the vaccine coming online, there's still, for the next few months at least, several months, a lot of people getting sick. And
Yeah, so let's talk about therapeutics. I have been very encouraged about monoclonal antibodies. I think that's the one area of therapeutics that really does. The data seems to be really quite good. You got to give them early. All the other efforts around therapeutics have largely not worked. I mean, the early stuff, hydroxychloroquine, that stuff has all fizzled out. Convalescent plasma was the other one that got authorization from the FDA. Really doesn't look like it's doing much. But monoclonal antibodies are, and there are a lot of other therapeutics that people are working on. There have been a few other things in the hospital, dexamethasone, remdesivir, which look reasonably good. So what we have done, I think, on therapeutics, Bill, is if an average person walked into a hospital sick with COVID on April 1 versus December 1, that person probably has a 60%, 70% lower likelihood of dying today than they would have on April 1. That's great.
That's a big delta, right? I mean,
big delta in short time.
Yeah.
And I expect that we need to continue making investments in therapeutics, because what we would like to get to, when I think out to the future, is I'd like to get to a point where even after vaccination, if I get infected, that there is something that I can get relatively quickly. It can dramatically lower the likelihood that I'm going to get very sick. I remain optimistic that's going to be possible, and we're going to need more than just monoclonal antibodies for that.
And I've read somewhere that some people think we're not using the monoclonal antibodies enough. Is that correct? I mean, is the system adapting quickly to what it should be using and not using, and et cetera?
Yeah, this is one of those odd moments and odd things that is happening where, we have, Lilly and Regeneron have put out that we have hundreds of thousands of doses. And, and those of us who look at this say, well, we have hundreds of thousands of people getting infected every day, so I wish we had more than that. But in fact, because there's a scarcity, people are just not asking to use it at all. And so we actually have a surplus. It's a very funny dynamic. And that's why you heard this week Secretary Azar say to hospitals, hey, we actually have enough around, use more. The key here is to use it early. And I think that's part of the problem, is by the time people are showing up to hospitals, they're pretty sick and the monoclonal antibodies are not going to be useful for them.
Testing, which I've been slightly obsessed with, that seems to be something we could have generated much more of and much more both the cheap tests and the more accurate tests and so forth. How all in, how much progress we made on that? How much of a constraint does it remain in terms of handling this going forward? Does the vaccine sort of take care of it, or do we still need the kind of massive testing capacity?
I think we need testing capacity. I think testing has been one of the surprising failures in my mind, and let me explain why. Like,
Yeah,
you know,
please.
there are lots of strategies that different countries have used for handling this pandemic. You have places like New Zealand, Ireland, just locked down. It's never going to work in the U.S. Not that kind of aggressive lockdown. Even mask wearing, which has been very complicated and political, which it shouldn't have been. But testing feels to me like a quintessentially American solution, right? It's biomedical. It's like, and we had lots of
Mass production, which we're good at,
yeah,
presumably.
mass production. We can do
Right.
it, and it would have given kind of empowered people to make good choices, right? Like you can test yourself at home every day or every 2-3 times a week, and if you're positive, then you don't have to go, you don't go out and you don't infect others. It would have made a big difference. The federal government actually at times played an unhelpful role, and at times I think actually played a harmful role. One of the things I have spent a lot of time in the last 9 months is talking to the companies that make these tests, trying to understand why we haven't been able to ramp up more than we have. We're doing about 2 million tests a day right now. That seems like a good number. It's certainly better than where we were, far from where we need to be. And let me give you some feel for why I think we need to be doing tens of millions of tests a day. Paul Romer, Nobel laureate economist, early on said we should be doing 30 million tests a day. So let's talk about the benefit of testing. Like, why would it be so useful? And then we can talk about where we are on testing. What I would like to be able to do, if I could wave a magic wand and have all the tests in the world that I wanted, I'd like to be able to do testing in schools a couple of times a week, everybody. I like to be testing people in nursing homes, in high-risk workplaces. I'd like to test everybody before they get on an airplane to fly. If you can do a 15-minute test and find everybody who's infectious, all of that would build confidence into the economy. It would make you feel much more comfortable going to a restaurant. Imagine a restaurant says, hey, come 15 minutes before your reservation. You get a little nose swab, you get a result. And then everybody in that restaurant is negative. That's helpful, right? It's going to make you feel much, much better. So testing is really something that I think can make an enormous difference. I recently moved to Brown University. Rhode Island had a pretty big outbreak this fall. Brown was testing every student and faculty twice a week. We basically had little to no infections among our students and staff, despite the fact that many of them live in Providence, in the community, because we could identify everybody relatively early in their outbreak and in their infection and isolate them. So testing is a very powerful tool for allowing you to keep the economy going. And this was something that many of us called on sort of early for federal government intervention. We said, look, testing supplies are national and global. Don't turn this over to states themselves. Engage states, let them do a lot of the work, but help states make sure that there is plenty of testing available. Ultimately, the president and his political team decided that's not the direction they wanted to go. And in fact, I think their constant underselling testing, and his words like everybody who wants a test can get one, or we're doing too much testing. When I would talk to companies, there were companies that could have turned on hundreds of thousands of tests a day, but they would have had to take their infrastructure and rejigger it, right? They were doing testing for something totally different. They would have had to stop that and turn it over to coronavirus testing. And what they would say to me is, you're asking us to forego millions of dollars of revenue to get into a line of business that we are pretty confident we can get into, but the president is saying there's no market for it. Like, why are we going to do this? And then people, like, I remember once talking to a CEO and I was like, how many tests a day could you do if you put it? He's like, I could do 500,000 a day. I was like, wow. So he's like, are you willing to guarantee me $100 million, check for over the next 6 months? I'm like, me? I could write you a few $1,000s, but that's not going to do it for anybody. But the federal government could. The federal government could.
The easiest thing for the federal government to do, right?
Right. And we're talking about hundreds of millions with an M. The whole investment back in February, March, April would have been in the tens of billions of dollars. So we were willing to put together a $3 trillion kind of a stimulus bill, but we were not willing to put tens of billions of dollars into testing. It was among the most maddening failures of this administration. And again, it would have just made this enormous difference. So let's talk about where we are now, because things have gotten better. As I said, we've got about 2 million tests a day. But I'm actually really optimistic that new technologies are coming online. Again, a lot of these technologies have existed for a good 6 months, but they're finally maturing enough that we can ramp up more testing. The stimulus bill, the coronavirus relief bill that just got passed last night by the House and Senate, has about $20 billion for testing for states. That's going to be enormously helpful. And the Biden team coming in has signaled that they want to make testing more widely available. I think if we're going to really get our economy back to a sense of normal, we're going to want to be in a place where testing is widely available, it's cheap, ubiquitous, fast. Because I have to tell you, like, I, as a global health guy, I would get on 15-hour flights to Hong Kong from Boston. I'm going to be less excited getting on a 15-hour flight if I think a bunch of people in the cabin are potentially infected. But if I know that everybody has tested negative before the flight, I'm going to feel a lot better. Again, it's all about building confidence in the economy. I think we can do it. I think the technology has really come on, but we still need the federal government and we need states just to continue to engage on this.
Yeah, what's so infuriating for me was sort of a version of what or follow on to what you said was maddening, which is precisely the people who spoke the most about opening up the economy, getting the schools going and all, which was not unreasonable, of course, to hope to do and want to do. That testing was pre-vaccine, it seems to me. Testing was the key to that. The key, as you say, to making people feel comfortable sending their kids to school, teachers feel comfortable going to school, school boards feel comfortable telling the staff that they could work there. Certainly true with businesses of all sorts, childcare, you name it. And it was, again, the most obvious thing, it seems to be. So that was, if you were for opening up, you should have been for massive testing. And it doesn't even get to the kind of weird, the mask thing was ridiculous, but I mean, it sort of got that burden quickly of becoming some kind of bizarre cultural symbol, which the testing isn't even, right? People are kind of used to getting tests for various things, and but they didn't do it. It's really that's really. I mean, we've paid a big some price for that already, don't you think? Even that could have helped even in September, October in terms of opening things up. I mean, but going forward, you're pretty optimistic that by spring, summerish, we'll have enough testing so the child care place can say, hey, we're testing the kids twice a week and we're testing certainly the staff and any visitor, and you can feel comfortable. Yeah.
I do, and I think.
And is this there are these two? There's this intra-testing argument, which I don't fully understand, between the sort of mass super cheap testing and not quite as accurate antigen, I guess, versus the more what we think of more as the medical testing, which gives you a very high percentage of confidence that you've caught it or not. Is that debate sort of being overtaken by events, or is it?
It's still a little bit of a debate, and I suspect what's going to happen is that we're going to have a variety of different tests for different contexts, and so I think about and again, I think with wide scale vaccinations available, it'll make it it'll become much more, in that way, a more supplementary, it'll be important for certain types of events more than others. But I still think important. But I think, for instance, I really do believe that we're going to get to a point where you should be able to get a cheap home test for $5. And those are going to be antigen tests. And what you'll know about them is that they are not perfect. You're going to miss a few cases every once in a while. So a negative test does not mean you're 100% assured you're not infected. But that's okay, because it's right now you have zero assurance that you're not infected, right? So if I can take that and drive it to 95% assured that you're not infected or infectious, that's pretty good. And it will
in a
also,
world where a lot of people have been vaccinated too, right?
Yeah.
So then,
and so that combination will help a lot.
Okay, so that's heartening. That's good.
Yeah.
I actually want to come back and ask you sort of what we've learned about the private sector and the biomedical industry and so forth, the ability to react to all these things, which all strikes me as a very interesting question. And there's some, I gather, hugely positive things, and maybe some others that not so much. But let's talk about the vaccines, which everyone's so interested in. So What's their efficacy? How confident are you on the logistics of the actual? As someone keeps saying, it's not the vaccine that helps you; it's the vaccination and so forth.
Yeah.
What is the time frame? Do you think? How much do we care whether it's the mRNA vaccine or these other, or the more traditional, I guess is the right way to say it, form of vaccination and so forth?
Yeah. So the vaccines have been one of the huge bright spots in this pandemic. And my goodness, we've got two vaccines that have been authorized by the FDA. Their data look fabulous. I mean, just way better than I would have expected. If you and I were talking 2 months ago, Bill, I would
Yeah,
have
I was going to ask
said
that. So, would you have expected it to happen this fast, and would you expect them to look as
a
efficacious?
little faster than I was expecting, way more efficacious than I was
Yeah,
expecting.
that's good.
And if I had to choose, I guess that's how I'd want it. I'll take it. But it definitely it's super fast, but much more importantly, super effective and looks really very safe. Um, and so that is fabulous. It's not a random coincidence that the two that made it through the gate first are both mRNA vaccines. This is a platform that the federal government has been investing in through research for years, not just the US federal government, European governments. It's a reminder of the power of investing in basic science. You just don't know when it's going to pay off. And if we had not invested in mRNA vaccines, right now we would be thinking maybe end of January, maybe February for the first set of vaccines. It would have looked pretty different and very different situation. So think about how much more hope we have going into the holiday season and the ending this year that we're about probably 6 or 8 weeks ahead, maybe 6 weeks ahead of the next set of vaccines that are going to come online.
And am I wrong that some of that investment in the science was it wasn't exactly done with this in mind? Some of it, I mean, the Human Genome Project or whatever, and a lot of people thought 5 years ago that what was the point of that? It was sort of, I mean, maybe I'm exaggerating, I'm sure I am, but it doesn't seem to be paying off much. So it is one of these kind of case studies, I suppose,
Yeah,
of how you got to do the work and you don't know quite
that's the
where
thing
it
about
pays off.
science. It doesn't pay off until it does.
Yeah.
And so you have to have a certain amount of faith that like investing in innovative, good science will teach us more about the world, and it will pay off at unforeseen moments. But the benefit of having these two highly efficacious vaccines, a couple of months before other vaccines, just the economic benefit of that is going to be in the tens of billions, if not hundreds of billions of dollars. Any scientific investment we made in this area way pays for itself and then some,
Wow.
right? So
And how much of that is we, the U.S., and how much of that is we, the developed world? Germany and others, they were involved,
it's a
obviously.
combination. Certainly, NIH has been a very powerful force for that kind of basic science research. And it will get us to thinking about the future and thinking about future pandemics. One of the reasons we got lucky with this vaccine, with the way we were able to do this in just 10 months, is we had quite a bit of experience with the initial SARS virus, SARS classic, as we call it, the virus that caused the SARS outbreak of 2003. Quite a bit of experience with another coronavirus, the one that caused MERS, which began in the Middle East and really affected South Korea. And so we had learned a lot about the spike protein. We had learned a lot about how these coronaviruses work. And so when this virus was identified, we realized, oh, it's a close cousin of the original SARS virus. And then we knew where to go. We could quickly develop the targets that we needed. That was incredibly helpful. We should not assume that in the next pandemic that's coming, and I can promise you there'll be another one at some point, probably sooner than any of us would be willing to tolerate. We should not assume that we're going to know the virus as well as we knew this
Hmm.
one. And therefore, it makes it that much more compelling that we invest in these platforms that can let us get going very, very quickly, no matter what virus shows up on our door. But I think so. Let's talk about rollout. Operation Warp Speed again has been, I think, one of the highlights of this administration. They've done a very good job of investing. Yeah, their standard criticisms of the plans are not as well laid out. That's probably true. But let's take a moment and say the Trump administration has gotten vaccines on Operation Warp Speed largely right. Um and the expectation is 20 million doses or 20 million people having gotten their first shot by the end of December. That was what they were promising. Now it's slipping into a first week of January. I look at that and say, Hey, that's great. That's still fine. The promise is an additional 30 million by the end of January. That gets us to 50 million, right? 20 plus 30. That's about 16% of the population of the United States. Again, I think we've probably had about 20% of people close to that already infected. Obviously, there'll be some overlap. But I expect by the end of January, 30 to 35% of Americans will have some amount of immunity to this virus. That's going to be amazing. That's going to start making a difference in terms of slowing spread in a meaningful way. And then probably another 30 to 50 million, so 10 to 15% a month for February, March. And then here are the wild cards. Johnson & Johnson and AstraZeneca. Johnson & Johnson has a vaccine that I think a lot of us are very optimistic about. We probably won't hear much about their data until mid to later part of January. Huge upside, it's a single shot vaccine. Now they're going to test a 2-shot to see if that's better, but they're trialing it as a 1-shot. A single shot will obviously make it much, much easier to get out and more people. So people are saying, anybody who can get a vaccine, who wants a vaccine can get one by summer. I am more optimistic than that. I tend to think April, May.
If J&J, if Johnson & Johnson comes online and AstraZeneca?
And if those two both come online, then I'm going to put my kind of bet on April as the month that anybody can get a vaccine. If it's only J&J, there have been some issues with AstraZeneca. They're sorting it out. Again, I think it will end up coming online at some point. Then it might be more like May. But again, look, pretty close. We can see that light at the end of the tunnel. So I'm very optimistic about vaccines and where they will land us.
How worried are you about resistance to being vaccinated?
Resistance to people being
human. I mean, people. 40% of the country say no.
Okay, I thought you meant like the vaccine, the virus becoming. Yeah. We could talk about that too. Some concern, and let me say a couple of things about that. The polling in the last couple of weeks has moved about 10 points.
I was struck by that, yeah.
So that 40% hesitancy has dropped to about 30%. Still a large number. The one part that worries me, Bill, and I don't know exactly how to solve it, is, anti-vaccine sentiment has existed for a long time in our country and has been pretty bipartisan. There are, kind of people on the left and right who are anti-vaccine, and it has not been deeply partisan. The vaccine hesitancy we're seeing right now is not just that standard anti-vaccine movement. There are a lot of other people who are really hesitant, and it is much more partisan than the data I've seen in the past. Many more Republicans saying they're hesitant about this vaccine, and that concerns me because, first of all, I think we can't turn vaccines into a political tribalism. Second, one of the things we know is that Democrats live with Democrats, Republicans live with Republicans. And if you end up having pockets of the country where large chunks of people are not vaccinated, they become reservoirs for disease, where the disease will circulate in reasonable numbers. And that really starts becoming a problem. So we could get to 60 or 70% of America vaccinated, but that doesn't necessarily mean that we'll have 60 or 70% of every community vaccinated. And that will be a source of ongoing issues for those people as well as for people in other communities. So I really think this is why I've been saying it'd be really helpful if at some point in early January we had the president get vaccinated on national television. Yeah. He holds so much sway and so much influence over a large proportion of the American population that him endorsing it and taking ownership for the vaccine. I'm happy if he wants to call it the Trump vaccine. I'm totally comfortable with that. We need people to feel comfortable with this vaccine.
Well, Joe Biden gave him, credit the other day, and that was intelligent. I think both gracious and maybe true and fair, but also intelligent from a public health point of view going forward, right? Because
absolutely,
you want his supporters to. I do feel there that I personally get slightly annoyed when all these senators and congressmen who were, encouraging irresponsible behavior and modeling irresponsible behavior for months, suddenly they're getting the vaccine, and as many people have complained, a lot of healthcare workers obviously haven't gotten it yet and so forth. But it probably is, from a public policy, if I can put it that way, public health point of view, a good thing to have a bunch of Trump-supporting senators and congressmen proudly, tweeting out photos of themselves getting
Absolutely.
vaccinated. It's got to help some in their communities,
Yeah.
and so
Yeah, I saw a photo of AOC and Marco Rubio right next to each other, both getting, like, not physically next to each other, but two photos. I thought it was great. Like, that's
yeah,
perfect. Those two probably agree on almost nothing, but they're both getting vaccinated, and that's exactly what we want. And there are a lot of people who are like, why are they cutting in line? They're not. I actually think the leadership of the federal government should be vaccinated.
yeah. I mean, there's a
We need a functioning government. This is not cutting in line.
yeah. No, I think there's some truth to that. Still, you can see why people get somewhat annoyed, and
Yep.
but well, that's okay. So I'm glad that you're optimistic about the. So you're looking at sort of at a late spring, summer opening up of things in a pretty big way. I mean, summer camps,
Yeah.
businesses, summer schools,
Yeah.
etc.
I will be honest with you that because one of the things I always try to do when I make predictions, the old Yogi Berraism, but predictions are hard, especially about the future.
Yeah,
But I try to calibrate against other people who I think are really smart and thoughtful. And there are a lot of people out there kind of giving their predictions, but people that I really look closely to are people like Scott Gottlieb, who I think has been one of the most thoughtful, on the mark folks in this whole pandemic, and others. I think Scott and I are probably both on the more optimistic side of things in the public health community. So if you were to kind of do a distribution, I think we're both a little bit more on the optimistic than the median. But yeah, I expect this summer coming up for my kids to be able to go to summer camp. I expect what I've been saying to folks is July 4th I'm going to have a barbecue at my house, and we'll have 20 people over. It will be outside. People say, well, what if it rains? Are you going to be comfortable? I'm going to make sure that everybody's been vaccinated. And if it rains, we'll figure out what to do inside, and we'll maybe have to do a little spacing. So it's not perfect. July 4th is not everything's back to normal, but a barbecue with 20 people in my backyard is not huge. I think we'll feel pretty comfortable.
well, that's good to hear. And so, what does that new normal look like in July, but also in September and in December? I mean, are we
Yeah.
wearing masks still inside? Are we distancing at all? Are we asking people to show they've been vaccinated before they get on the 15-hour flight to Hong Kong, or before they drop their kid off at the childcare center? How different is life than it was a year
Yeah.
ago?
It's a good question. I see somewhere around March, things starting to feel different, and I see a glide path to a new normal. And so I see stuff starting to open up more in March, April. I think summer is the time where it's going to feel really different and meaningfully better. But does that mean that would I feel comfortable going to a restaurant indoor? Last time I was in indoor dining was actually March 1st. And would I feel comfortable going out to a restaurant with friends over the summer? I think so. I think so, but my expectation is going to be that they're going to have gotten vaccinated, and I will have gotten vaccinated, and the restaurant will have made some modifications to improve airflow, um, and so I think that I think can happen. But then I start thinking about, like, what about a music concert where you're inside, you're kind of packed, large hall. Then I think, or a movie theater. So my kids love movies. I go with them because I'm trying to be a good member of the family. Um, I think I can imagine going to a movie theater in the fall, but I think I'll be wearing a mask. I think a lot of people will be wearing masks still. So it's one of those things where I see some amount of mask wearing in what are quote unquote more high risk situations, and and then there's all sorts of interesting questions. So this is where I actually think one of the messaging of public health has been a real problem, is where people are saying, well, we'll be, we're still going to need to wear masks forever. No, no. But mask wearing will change. And speaking of Hong Kong, I remember the first time I went to Hong Kong, maybe 5, 6 years ago, I was struck by the fact that any given day I might see 5% of the population wearing a mask. Never saw people wearing masks in the US.
Right.
I can imagine that in our future. In the future, you wake up one morning, you have a cold, you have runny nose, sore throat, you're coughing. You might just put on a mask that day. And that'll become a bit more normalized. That would have never happened in the US, 2 years ago. But I do see that by the fall, kids are back in school. I think there's some really interesting questions about mandates. Will school require kids to be vaccinated? I always say, look, as a doc, my hospital where I've practiced for years is very clear. If I don't get the flu shot, I don't get to. I get my privileges suspended.
Yeah. It seems to me we showed our kids a few years ago in the public schools here in Northern Virginia had to show that our kids had certain vaccines before we brought them, on the first day of school
Yeah,
or before bringing them to school. So I
yeah,
don't, but I guess there are legal and then just compliance questions about you're gonna have to show that when you go to the concert at the Kennedy Center. Or you're gonna have to
right.
show when you go. Can Delta require? They require other things, right? You got to go through all the TSA stuff. Why it wouldn't be that much more of a burden to say, bring your driver's license and your passport and your vaccination card. Are we going to live in a country, do you think, where a society where we sort of kind of carry our vaccination card around? I'm not particularly against it, but some people will
Right.
have a big, won't like that, I suppose.
Yeah, I can imagine. So I don't. People have asked. Actually, it's interesting. I was on Newsmax recently. I was surprised they had me back, but they asked, is the government going to mandate? I don't see the government largely doing things like this. But can I imagine Delta? I mean, Qantas CEO has said he's going to require immunizations when they become widely available. That they're going to require immunizations for all long haul flights. I can imagine Delta doing the same. And right now, like again before the pandemic, when I booked my Delta flights, all my information was in there. My TA SETIA number, my passport, my immunization verification will be in there, and that I think that'll become an automatic. So I can imagine airlines doing that. As a private business, I think they're more than able to do so, uh, and the trade-off for them will be they will lose a few customers, but there will be a lot of other customers who will feel a lot more comfortable, and they'll have to decide who their high margin customers are and where they fall down on this.
Yeah, and I suppose not to obsess about international flights, but since you mentioned that, I mean, of course, not just Americans on these flights. Then it does become kind of a global question at some point of, well, but if other countries aren't as far along, if Nigeria's only got 20% of their citizenry vaccinated by the end of the year, are they not going to be able to fly on that same flight if they don't have? I mean, there'll be lots of interesting.
A lot of policy questions, a lot of yeah.
What about the global side? How optimistic or worried are you that we end up in pretty good shape by a year from now, but that other countries aren't? Or could the vaccines be made cheap enough and distributed effectively enough that it can be sort of solved worldwide without exaggerating? I mean,
Yeah, again, this is one where a lot of the public health people are saying, okay, much of the world is not going to get vaccinated until 2024. I think that is way too pessimistic. Um, and this is where actually I'm like my fingers and toes are crossed for the AstraZeneca vaccine, because that's the one that has the best chance of vaccinating the world.
because it's just so much cheaper.
Super cheap. There have been big bets on the AstraZeneca vaccine. So the Serum Institute of India. So India is one of the major kind of global producers of vaccines under any normal circumstances, and a couple of the big manufacturers of vaccines in India have really bet big on the AstraZeneca vaccine, producing hundreds of millions of doses. And if it turns out that the AstraZeneca vaccine ends up being a flop, I don't actually expect that. I think it will end up being, then that's going to be a huge problem. So again, I'm hopeful that that vaccine will end up really looking good, safe, effective, and so we should have a reasonable amount of those. Again, in the stimulus bill, I don't know, keep calling the stimulus, the COVID relief bill that just got passed, there's $5 billion for global procurement of vaccines for Gavi, and Gavi is the global alliance on vaccines. And again, we should absolutely, first of all, I think America has a long history of like being a leader in global health. It's been deeply bipartisan. The most successful global health program of the last 30 years is PEPFAR, run by President Bush, or launched by President Bush. So I think our global leadership on this should be very strong, but also we benefit if the world gets vaccinated. So I don't expect that by the end of 2021, everybody who wants to get vaccinated in the world will, but I suspect a large chunk will. But again, the caveats here are AstraZeneca's got to pay off. A couple of the Chinese vaccines have to pay off. The Russian vaccine, I'm hopeful, will pay off because, again, those are relatively easier for others to reproduce and make lots of. But certainly by mid 2022, I expect things to be in much, much better shape vaccine wise around the world.
Okay, well, that's good news too. Um, let's talk about lessons learned, I guess. I mean, there's so many ranging from globalization and how important that was to actually dealing with this problem. It may have compounded the problem a little bit at the beginning, I suppose, or accelerated the spread of the pandemic. But to our biomedical industry and how it's done, to government at different levels. So, I mean, we can just run through a bunch if you want. But I'm just very curious. But maybe I'll begin the opposite way. What key lesson? What if someone said to you, okay, quickly, what lessons should a serious senior policymaker learn about our government and to some degree our society, our whole capability as a country from this? What are your core takeaways?
So if it's okay, I'm going to start off by saying, like, if you and I were speaking 2 years ago, what I would have said and what I got wrong, because maybe that then leads us to what are the big lessons.
No, that'd be great. And it'd be so rare for someone from Harvard and Brown to admit that you got something wrong.
Oh,
this will become a famous conversation. It's like you'll probably get expelled. Well, luckily you're not at Harvard anymore, so it's okay. You can admit that
we're a little more humility here down in Providence. No, look, so I wrote a piece at the end of January, Bill, in the journal Health Affairs, in which I laid out what was coming, the pandemic that was about to arrive around the world. And it's a fascinating piece because I got so much of it wrong. And the basic thesis of it was I was very, very worried about the world, but I was not so worried about the United States. And what I wrote was that America was going to do fine. We were going to do well. We had a great public health agency in the CDC. We had a fabulous biomedical infrastructure, and that the U.S. was going to end up doing well. But that the world needed American leadership. And I actually talked a lot about the importance of global leadership from the United States. And it's a good piece. I mean, I've gone back and read it maybe 4 or 5 times and trying to remember what I was actually thinking. It is important to think about why did I get that so wrong. Over the last 5 years before this pandemic hit, a group of us have been working on trying to do assessments of how ready was the world for the next pandemic and what are the metrics we want to look at. And we tended to look at things like laboratory capacity, surveillance capacity, public health capacity, biomedical infrastructure. America is just awesome on all of those. We did not spend enough time thinking about social cohesion, governance, effectiveness of government. And so in the old model that I had worked on and developed and thought about, Western Europe and the United States would do very, very well, but you'd really worry about Africa, you'd really worry about South Asia. And it turns out the African continent has done very, very well in this, has done much better than any of us expected. Western Europe has been a bit of a mess, and the United States has been a disaster. And despite the fact that I think our biomedical industry has been nothing short of extraordinary. Not just the vaccines, what they have done on therapeutics, the innovation in testing. It's just that it takes time for the private industry to take a product and then bring it up to scale. This is why you need public-private partnership. This is why you actually need a functioning government to help the private industry. Because the timelines, you got to go to the capital market, you got to raise dollars. Stuff takes too long in a crisis. So to the extent that our private industry has underperformed at all, and I really don't think they have, it's because they have not had a strong partner in the public sector. What's been remarkable, so I think it was March 6th, I was sitting in my office in Cambridge, and the head of the Africa CDC was visiting with me, and we were just sitting and talking about this pandemic that was coming. And he was describing the tens of millions of tests he had ordered up that were now going across the African continent. And remember, we couldn't do any testing in the US on March 6th. And he had called all the health ministers of Africa to come, I think to Lagos, and they were going to create an Africa-wide plan for how they were going to manage the pandemic. And I remember being struck by the difference between that and what was coming out of the White House. Imagine if the White House had said, we're going to have tens of millions of tests. We've called all the governors in. We're going to have a national plan. And he ran a CDC. It wasn't even a head of state, but they were developing an Africa-wide plan. Africa has done remarkably well compared to the United States. And so and again, countries like Vietnam have done incredibly well. So yes, we point to Singapore and Hong Kong, but Singapore is a city-state. It's a very unusual place. Lovely place, but very unusual. China has done very well, but like I don't want the Chinese model of like, shut people in their homes at the with a guard at the door, kind of police state. But you don't have to have that. And what it has shown me is that I had undervalued governance. I had undervalued leadership in a certain kind of way, and our systems were just not resilient to having a particularly poor quality leader. And the social cohesion stuff has been really a challenge for us, because there's still large streams of America that believe this thing is a hoax, that it's overstated. That I didn't see that coming either, and I guess now pulling back, saying what are the lessons? One certainly is that you need a strategy for combating misinformation, and you don't want the president himself to become a spreader of misinformation. And he hired ultimately by late spring summer Scott Atlas as his chief health advisor, who not only knew very little about this, but became a major source of spreading misinformation. So very bizarre world where the White House becomes this very schizophrenic place where you have those, and you still have people like Debbie Birx and Tony Fauci trying to go out and fight the good fight about the data. It's just a very so one is kind of clarity of message and consistency of message. That I think cannot be overstated, and really building a coalition of people across the political spectrum to amplify those messages. We didn't do that. That I think really hurt us. And then I think recognizing that we had all the tools and all the capacity in our country to have a very different outcome, have a much stronger economy, have far fewer deaths. But it required a set of political factors. I don't like, this is obviously not my area of expertise. Like, again, I struggle. Let me just make one last point, and then I'd love to hear your thoughts.
This is fascinating. Yeah.
I struggle with, like, again, I got so much of this stuff wrong because I thought, okay, if our president doesn't really do a good job, governors are on the hook for the lives and livelihoods of their people. So I expected a much stronger pushback from parts of our, let's just be honest, the Republican parts of our government, governors and senators and members of Congress saying, what the heck are you doing? We need to have an effective response. And, what was interesting was over the summer, I worked with a bipartisan group of senators on trying to craft what we thought was going to be a relief bill over the summer to get more testing out there. And these guys on a one-on-one conversation, super reasonable. They totally understand what's going on. They understand how bad things are, but just felt like publicly they could never push back against the White House. I don't understand that stuff. That is beyond me. But that was certainly a major lesson of you can have all the infrastructure you want. You can have great biomedical infrastructure, but if you don't have a government that functions, it's very hard to manage a pandemic.
No, that's so interesting. I mean, I guess you have to put the public back in public health. I mean, the great virtues of public health, now that I've learned more about it in the last 9 months compared to the old days, compared to medical school, let's just say medicine, qua medicine, is it always has tried to think about the public side of it. Now, most of that has been contagion, kind of the more medical side of the public side of it,
Yep.
so to speak, the epidemiological side and so forth. But it turns out the actual, I guess what you're saying is both the actual governance, not doing the tests and so forth, and the more public rhetoric and social sort of governance or influencing have been important. I don't know which of those you think more important, but I mean, I'm very much with you that, it's one thing that you could have had a president who was kind of out to lunch, let's just say, and even vaguely irresponsible. If the rest of not just the government, but the rest of the executive branch, the rest of, not the rest, but Congress, and influential, and here I do, this is a world I've been close to, but influential conservative leaders and journals had all been responsible. One thinks that one could have minimized the damage. But I mean, for me, and I really almost lost it this morning when I saw this, the Wall Street Journal editorial page this morning, December 22nd, published an op-ed by Scott Atlas.
Yep.
After the guy has never really had the credentials to discuss this in a serious way, but then I would have thought totally discredited, clearly pushed herd immunity as an idea there for months. And the Journal, we're not talking about Newsmax, with all due respect to your friends on Newsmax who have you on. We're not talking about some, fringy internet site that whatever. This is journal. This is the paper for the American business community, the
Yeah.
mainstream business. They tend to look at the editorial page and think, well, that's, maybe I don't quite agree with everything, but it's kind of the reasonable version, you might say,
Yeah.
of conservative or Republican thought. And they're publishing Scott Atlas on December 22nd, not on April 22nd, when maybe there was a reason to have some contrarian voices.
Yeah.
For me, that's a huge problem. I don't know if it's a huge problem. It's a big problem for the country. I mean, I don't know if it's a real problem for public health going forward, but anyway.
But it is in the sense that, I for years have subscribed to the Wall Street Journal, and I for years religiously read the opinion pages. I often disagree, but I wanted to understand what people who disagree with me, who are smart and thoughtful, think about the world, right? Because it helps me calibrate my own ideas. But the amount of just junk that has been showing up there, I mean, stuff where you're like, it's not a serious argument. Like, there are serious arguments. There's some serious arguments about issues around, everything from civil liberties to what we want to tolerate to how much death, and no, of course we can never get to zero, and so what are the costs? Like, there's some very important conversations we need to be having. The Wall Street Journal's op-ed pages are not having those conversations. That's not what is happening.
And that's done a huge amount, in my view, to enable the kind of the Republican governors, the Republican senators, not to rise to the occasion. So it's a bit of a catch-22, who's enabling whom, I suppose, or who's, but the combination, the infrastructure below Trump has made it much harder to minimize the damage, I would say, or the downside of having Trump as president. But hopefully we'll come out of that somewhat. I mean, we'll see going forward. I mean, it will be interesting to see what the governors change their tunes by February, March, as they see vaccines coming online, and they want the vaccines for their citizens, and they get a little less crazy about, they want to be able to open up safely, and suddenly they get much more responsible about about encouraging people to be tested and so forth. It'd be an interesting question without Trump in the Oval Office, actually, how that works. What about the rest of America? I mean, technologically, you mentioned big pharma. What about little startups? We have a decent mix of those two, you think, innovation and massive logistical capacity. What kind of lessons in that whole area?
Yeah, I mean, I certainly think, it's interesting to think back to where we were in 2019 and think about back to some of the narratives, and again, I'm going to obviously think about it from a health and healthcare point of view, but the narratives about pharma were mostly negative about drug prices and how those are going to still be issues, but like pharma has come through in a very, very big way. When people hear the word Pfizer, the name Pfizer right now, most people's hearts get filled with warmth. So I think that is going to. So I do think that changes a bit of the political calculus, but more importantly, the underlying scientific community's response, having spent most of the last year in Cambridge, watching biotechnology companies turn on a dime, take almost whatever they were working on, and now they were working on COVID. Extraordinary. Companies have totally retooled, have some of the greatest, coolest new tests that are going to be coming online have come from companies that didn't do diagnostic testing. They did something totally different with their genomic sequencing, and yet now they're going to be able to do this.
And of smaller and newer companies, right? It's not just
a lot of
the
small
massive
new companies,
big pharma that have done
exactly. And then when they need to scale, they work with big pharma, and they work with these bigger ones. So I think this has been a huge, I don't know what the kind of right term is. This has been a heyday, sort of, for the biotechnology pharmaceutical industry comes out looking very good, and rightly so. They did a lot of things right, despite not getting the kind of support that would have been helpful to really scale this up. And I think we'll see the benefits of this bill in 2021, because these things are now coming online, and you're going to have more resources and a more willing and partner in the federal government, and so I think we'll see that, and I think it's going to be great. So I think that part has been great. The other part that has been interesting is this traditional, I shouldn't call them traditional, because what is traditional technology companies? But when you think about the Apples and the Facebooks, and there was a sense of we were going to build these super cool apps and be able to do all this great trace. That stuff mostly fizzled.
Yeah, that's interesting, isn't it? I remember that was Jared Kushner press conference. What was that? April, I guess.
Yeah.
Or March, maybe. I don't know. Yeah.
And so those companies, I don't know that they again, they've done very well in their own business models, but I don't know that they have come through this feeling like they are essential to American kind of response. And that to me is interesting, that biotech and those incredibly important, the more traditional techs. And then of course there's Facebook, which I think has some real problems. And over the summer, there were a couple of times when I gave talks where I talked about the relentless misinformation that is being thrown around and was being directed towards public health people. And I mentioned the Googles and the Facebooks. And Google's response was immediately like, what are you talking about? What are you seeing? Talk to us. We're on it. And they put very, very senior people. And when many of us reached out to Facebook, we got kind of like third or fourth tier people, their small team working on misinformation. You just had a sense that they don't really care, that that's not a priority. And and there are a lot of people who feel very much like Facebook has been the misinformation spreader in chief, and they largely are not willing to engage in a process by which they become they stop that. And I think, again, I'm not a big fan of I don't know, like I don't know what the right policy response is, and I'm weary of government getting involved excessively. We've seen what the president wants to do with Twitter, but at the same time, I think Facebook needs to sort of do some soul searching about what kind of company it wants to be and whether it wants to continue to spread.
It's certainly a discussion worth having, and it does show how broad, when you think about public health in that sense, you get into real big questions of Facebook regulation, which is not maybe in the classic public health wheelhouse, but it turns out it's important, right? I mean,
yeah, and I feel like I have neither the expertise nor the kind of sophistication here to know what the right way to do this is.
Who does?
What I can say is, as a very public-facing public health person, I have been inundated with misinformation. It's just come at it, and you can see a lot of it is spreading through Facebook.
Well, and it's had an effect too. It's one thing if it spreads, but it's all sort of irrelevant.
Oh, huge effects.
Yeah. What about just hospitals, doctors, medical schools, public health schools? Looks to me like from the outside they've all done pretty well, all things considered. Would you agree with that? We have a pretty decent.
Yeah, I do. I think there are two things here that I think. First of all, I think medical schools, doctors, hospitals, again, like phenomenal response. Now, what's interesting, of course, is in the middle of the biggest public health crisis of a century, a lot of these hospitals are going under because of the financial impact. It's a very weird policy situation where health crisis and the healthcare industry is suffering, losing jobs. That's a lot about our payment models and how our system works. But certainly from a public perception point of view, I think largely people feel way more positive, and I think rightly so. I mean, my goodness, again, think about the fact that like doctors and nurses and others went into rooms and took care of people with COVID while wrapping themselves in garbage bags because there weren't enough protective equipment, right? Like that's heroism, right? Like that's the kind of stuff that is like, legends are made of kind of thing. So I think,
but horrifying that we didn't have enough, from my opinion, my amateur opinion, that we didn't have enough PPE. The one thing we should be like extremely good at is mass producing this kind of thing.
We still don't. I mean, even now there are, in hospitals, not enough N95s, and so people are still recycling them and using them over. It's just pathetic. Like that part is, what are we doing? Like we should have had hundreds of billions. I should have had billions of these things produced, hundreds of millions of these things produced. But anyway, hasn't happened. But that I think they do. Public health is interesting because obviously there have been a lot of very visible public health people, and there has been, I think, pushback on the public health community that there isn't enough willingness to understand other perspectives around the economic costs, and I take those criticisms for what they are intended, which is I think a lot of them are well-intentioned, good criticisms, and they're right. And part of it is I look at my friends and colleagues who are economists, who are political scientists, and when they speak up about the pandemic, there is a bit of a tribalism in public health that says, "Whoa, this is a public health crisis. Stay in your lane." And I'm like, no. This is too big a crisis for it to be managed. It's the old sort of saying, like it's too important to be left just with the public health people. Like this is a society-wide crisis. I want to hear from the economists. I want to hear from the everybody about what the right answers are.
I mean, in a normal administration, you'd have your Larry Summers or Glenn Hubbard, and they would be in the room with your Tony Fauci's, and they would have an intelligent discussion about
Exactly.
some of the trade-offs, or when we could open things up, or what would reassure people to open things up, and should we prioritize testing
Right.
a little more than this because would have huge positive effects on the economy, which affects people's lives and health as well. But of course, we never even had that, and that's
No.
one of the tragedies. We never even had a serious discuss. We had serious discussions on the outside. I've got to say, I think we
Yep.
real tribute to people like you and others. Pretty serious. It shows that the society as a whole. You might say, I feel like did reasonably well. Did a mixture, but parts of the society did reasonably well in coming to grips with this. But not here in Washington D.C. except for isolated outposts who were under attack most of the time.
Yep.
The actual public health professionals. A final thing, I'll let you go shortly. You've got a million things to do, but this has been fascinating. Though we'll have to do another one. But so let's assume we get back to a new normalcy, a new normal in, I don't know, September or something, and President Biden or whoever calls you up and says, "What about okay? There's going to be another pandemic. How are we decent? Have we learned some lessons? Have we learned some lessons? Have we applied those lessons? What worries you the most going forward? What would be the well? So
Yeah. So I actually do think there's going to be at some point again another pandemic because all the circumstances that led to this one continue to exist. Um, in 2015, I put together a course when I was at Harvard. It's called Lessons from Ebola, Preventing the Next Pandemic. And ironically enough, in that course, I asked every expert that I had on, we had these discussions. I would always ask them at the end, the last question that I asked was, okay, it's 2015 right now, but imagine in 5 years, imagine in 2020, there's a global pandemic.
yeah, wow.
And then I would start with, and imagine it's a virus that comes from China. Um, and it's an influenza virus. I did not think it was going to be a coronavirus. Now you may say, "Wow, Ashish, you're prescient." I'm not prescient. Like all of us knew this was coming, and none of us knew it was going to be 2020. But so why China? Look, China has gone through this incredible transformation in the last 30 years, massive economic growth, but it has come with deforestation, more human-animal interactions. Almost every new disease outbreak is a jump from animals to humans. And so China was kind of ripe to be that place. It's not about Chinese culture or there's all this kind of anti-Chinese stuff that comes up. I can promise you there will be another pandemic. It might come from India, it might come from Africa, it might come from the United States. Um, it turns out we're part of the globe. So that's coming. And what do we need to do? Well, we certainly need to go. I mean, some of the things that we were talking about good surveillance systems, laboratory capacity, all that still is there. But I have come to realize from this pandemic is that I overemphasize those things because those were sort of technical solutions. I think we need a strategy to think about governance a lot more effectively. I think we need to have a different approach to what we want WHO to do. I mean, part of the problem of WHO has been that everybody wants it to be everything. And therefore, WHO ends up really being constrained in its ability to do anything super well. So we need to rethink that. Um, so there's a whole set of investments. And then on the biomedical side, what I brought up earlier on the issue of like the mRNA platform. I don't know what the next virus is going to be. Again, if I had to bet, I'd say influenza virus from Southeast China, because that's probably still the most likely. But it could be anything. So we need to make substantial biomedical investments to be far more prepared. And I think, given the estimation from Larry Summers that this pandemic is what cost us about $15 trillion, I think we can spare a few $1 billion for a scientific enterprise where those investments are made. So, and maybe the one last point is this is a point that I think many of us have been making for years under President Trump is that America first. Look, every country thinks about themselves first. That's not a problem. But the issue of like isolationism, building walls, it just doesn't work in this century, like given the globalization, travel, everything else. So I think America has to be deeply engaged in the global architecture. We have to work with countries and partners. We have to enable the rise of Africa. Africa, again, is going to be a very exciting place. I want America to be good partners with the African continent and the people of various African countries. I think you need a whole government approach to responding to the next pandemic. I think that's a vision that, from everything I know, President-elect Biden believes in. I also think this is a vision that President George W. Bush would have believed in and probably did believe in, does believe in. So again, the last point here is these have been deeply bipartisan views. I testified over the summer at the Senate Foreign Relations Committee about America's withdrawal from WHO. There were a couple of Democratic witnesses, a couple of Republican witnesses. There was no daylight among any of us. And I can't remember feeling any different being asked questions by a Republican versus a Democratic senator. Everybody's more or less on the same page. We got to do these things. That's what we need is to restore that sense of bipartisanship on these issues.
Of course, that's a big task, but it is I do think it's appropriate to end on that. That the fixing the political system would help our public health response a heck of a lot, right? So, so many of our conversations have been more about politics, but it intersects in a very, very big way, and I think you've made that clear today. Look, thank you, Ashish, for this really I found fascinating and educational conversation, and we'll have to if it's okay with you, get back together in a few months and see what we got or what you got wrong. I'm sure much more what you got right, but also going forward, as you say, it's not as if we just get through this, heave a big sigh of relief, and these issues go away, and the lessons do have to be learned. But thank you so much, not just for this conversation, but what you've done over the last this past year, which I think has really been a genuine contribution to our public. To our public life. So thank you for joining me.
Thank you for, so I want to say thank you for having me. And this was fun to think through some of these issues with you. And I'd love to come back in the future if I can be helpful.
Well, we'll do that. And
right.
Good luck at Brown and everywhere else. And thank you, Ashish. And thank you for joining us on Conversations.